Hi. So today this is a presentation about understanding health promotion. My name's Carl Finn. So, understanding health promotion. Health promotion is a key concept within health and social care because many of the major health problems facing society today are actually preventable rather than being unavoidable. So we've got conditions such as obesity, cardiovascular disease, type 2 diabetes, and some cancers are also strongly linked to like lifestyle choices and social circumstances rather than genetics alone. Health promotion essentially focuses on improving the quality of life and reducing pressure on healthcare services by preventing illness before it actually occurs. So this presentation will explore the health promotion models, evaluate their effectiveness, examine a national health promotion initiative, and evaluate the role of a public health organisation in improving public health outcomes. So what is health promotion? Health promotion essentially enables individuals and also communities to really take control over their health and well-being. So what it actually does, it focuses on the prevention rather than the actual treatment and considers the wide determinants of health, such as things like housing, education, income, and the environment. For example, encouraging, let's say, physical activity is more challenging in areas with limited green spaces or high crime rates. This sort of highlights the importance of addressing social and environmental factors in health promotion. So now we're looking at the models of health promotion. Health promotion models provide frameworks for understanding how health can be improved. Common models include the medical model, the behavioural change model, the socio-environmental model, and the empowerment model. In practice, healthcare professionals often combine these models, such as treating the illness medically whilst also providing lifestyle advice and community support. So it's never really just done as a kind of as a one fix sort of thing. You know, it's usually encompasses a few of them. So moving on to the medical model then. So as it says here, it treats the illness, professional-led and reactive approach. So the medical model focuses on diagnosing and treating the illness, and it's led it is led by healthcare professionals. Patients are often really quite passive recipients of the care that they get. A real life example with this would be maybe the treatment of asthma using inhalers. So whilst effective in managing the symptoms, the medical model does not really address the underlying triggers such as air pollution or smoking, making it's more of a reactive rather than a preventative sort of fix. The behaviour change model. So this focuses on the lifestyle choices made by the individuals. It's education based and it's preventative. The behaviour change model encourages individuals to adopt healthier lifestyles, including healthy eating, exercise, and quitting smoking. Smoking cessation services are a real world example, providing education and support to quit. While effective, this model assumes the individuals have equal capacity to change, which may not be realistic due to social or economic barriers. The comparisons of two models here, so we've got the medical model versus the behaviour change model, which is treatment versus prevention, professional versus individual focus. They're the sort of comparisons there. The medical model focuses on treating the illness, whereas a behaviour change model aims to prevent the illness. For example, diabetes can be managed with medication under the medical model, but behaviour change, such as diet and exercise, can prevent or reduce its severity. So both models are important and work best when combined, so that it's almost like a collaboration between the two. Evaluation of health promotion models. No single model really is fully effective alone. The medical model treats illness but does not reduce future risk, while behaviour change promotes long-term health but may widen inequalities. Often a combined approach that addresses treatment, behaviour and social factors is the most effective strategy for improving public health. Health Promotion Initiative, Change for Life. So Change for Life is a UK government initiative designed to tackle childhood obesity. And what it does, it focuses on the families and promotes healthy eating and physical activity. The campaign uses positive messaging and simple guidance reflecting the behaviour change model. What the aims are then of Change for Life: reduce childhood obesity, promote healthy eating and increase physical activity. So it's to improve children's and families' health by promoting the long-term healthy habits. It's all about healthy habits here. Examples include encouraging, say, 60 minutes of daily physical activity and, let's say, reducing sugary drink consumption. Many schools support this through their Change for Life activity clubs that they run. The objectives of Change for Life. So they improve nutrition knowledge, reduce sugar intake and encourage exercise fundamentally. Objectives include reducing sugar and fat intake, increasing physical activity and raising awareness of healthy choices. The Sugar Smart campaign also helps families identify hidden sugars in foods, enabling more informed decisions. The evaluation of Change for Life. Change for Life has raised awareness and engaged families through accessible resources. However, it has been criticised for placing responsibility on individuals and not addressing food affordability or advertising. This does limit its effectiveness for disadvantaged families quite often. Public Health Organisation, NHS. So the National Health Service plays a key role in public health by providing universal access to healthcare. It delivers both treatment and prevention services, helping to reduce health inequalities across the population. The NHS contribution to public health. So the NHS supports public health through vaccination programmes, through screening and through health education. Childhood immunisations have reduced diseases massively, such as measles, while cancer screening programmes improve early detection and actual survival rates. The evaluation of the NHS contribution. So the NHS has significantly improved public health outcomes, including increased life expectancy. However, challenges such as funding pressures and staff shortages can limit preventative work. Despite this, though, the NHS remains central to public health improvement. So to conclude, really, health promotion is essential for preventing illness and improving quality of life. Combining health promotion models is the most effective way. It doesn't seem that, any one of these models works. I suppose it would work on its own, but often a collaboration is needed with two or more of these models to be most effective. Initiatives such as the Change for Life and organisations like the NHS does play a vital role in improving population health. Thank you.